Hi, it's Edo Love again. Yesterday I took care of a patient with an intra-aortic balloon pump, and I thought to make a video about nursing management for a patient with an IABP. So I will be telling you about the device, tell you how it works. I will tell you about nursing management. Let's get right into it. So
Okay,
what is
let's
an
go.
intra-aortic balloon pump? As the name suggests, it is a balloon that is placed inside the aorta and it pumps. Device used short-term in patients with stressed heart. A common example could be cardiogenic shock. Pump help the heart do its work, so the heart does not have to work as hard. For example, a patient who is not doing well, is requiring really high levels of vasopressors and is not improving, could benefit from the use of an intra-aortic balloon pump. The balloon pump is a short-term treatment to help stabilize the patient or a bridge for more advanced therapies. So how does the balloon pump work? The balloon pump is inserted in the cath lab or at the bedside, but mostly in the cath lab. So a single sausage-shaped balloon is wrapped around a vascular catheter and it is placed in the descending thoracic aorta. Usually they go through the femoral artery, so they go through your groin area. After the balloon has been inserted in the patient, it is connected to an IABP monitor, which is a very expensive device that is used for troubleshooting and displaying patient hemodynamic parameters. So how does it work? The balloon pump works by counterpulsation. So pretty much the balloon is inflated and deflated, and this can be triggered by EKG manually. For the most part, it's going to be triggered by EKG. Helium from the tank on the machine helps the balloon deflate and inflate. The balloon deflates when the aortic valve opens and it inflates when the aortic valve closes. So when the balloon is inflated, it helps blood stay in the aortic arch and supply coronary arteries. When the balloon is deflated, when the ventricles pump, it helps improve cardiac output. So pretty much the patient's heart is working, but it is being assisted because of augmentation of the diastolic pressure. So if you look at the monitor, the augmented diastolic numbers is something that you record, and there's a set number. If it goes below that, the machine will alarm. So because of the use of the intra-aortic balloon pump, their coronary blood flow will be increased, their cardiac output will increase, and because the heart is pumping enough blood to the body, urine output will increase and their mentation will improve. From my experience, very high doses of vasopressors will be weaned down and the patient's mentation will improve, their urine output will improve, and pretty much from declining, they're going to start getting better. On the other hand, if the patient is not responding to the balloon pump, other forms of ventricular assist devices will be considered. For example, Impella or ECMO. This is in case things are getting worse. I will make a video on Impella or ECMO later on. Please subscribe so you can be notified of new videos coming up. Now let's talk about nursing management. We will start with assessment and recognition of abnormal findings. So if you have a patient who is on a lot of vasopressors and he is not improving and you keep titrating up, you want to let the doctor know immediately. So if they need more advanced therapies, for example, the short-term balloon pump placement, it can be done. So pretty much you do that, and once it's decided that the patient will get a balloon pump, You're going to get the patient ready to take them down to the cath lab. And while the procedure is being done, you can help monitor their hemodynamic parameters, or let's just call it their vitals. You will also be assessing the patient's groin site. You're going to make sure the leg the pump is placed on is immobilized, so the patient cannot dislodge the catheter. You're going to be monitoring their pulses. You're going to be monitoring their sensation, monitoring for any change in level of consciousness, monitoring their urine output, their GI function for pain. For example, if they have back pain, it could be a sign of bleed. You're going to be monitoring for bleeding and hematoma at this site. You're going to be checking your distal pulses at least every 15 minutes times 4, 30 minutes times 2, and then every hour after that. You need to make sure that the patient's head is not lifted above 30 degrees. If you have to clean the patient, you should log roll the and involve flexion at the hip. You are also going to be looking at the machine. You will be charting your assisted and unassisted systole and diastole, and especially your augmented diastolic pressure. If it's not within range, you need to let the doctor know or the perfusionist know instantly. If the machine malfunctions, you need to let the perfusionist know as soon as possible. You also need to follow your organization's policy on IABP. Sometimes you have to flush the device every 4 hours to maintain patency. Hello, this is Edolov. That was a quick overview of intra-aortic pump nursing management. So from my experience, I've seen a patient who had the balloon pump for 5 days and their cardiogenic shock resolved. The pump was weaned off and they were extubated and went home. I've also seen patients who was placed on the balloon pump and did not improve and had to be put on ECMO. So that was a quick overview. You can leave me any questions. I hope you gained some value out of it, out of this video, and subscribe and let me know what other content I can make.